I rise today to celebrate the life of Dr. Paul Farmer, a visionary in global health, crusader for health equity, and accomplished physician with an unparalleled passion for social justice. Dr. Farmer was my mentor, my professor, and my friend. He was completely selfless, and his relentless dedication to those less fortunate inspired me and helped shape me into who I am today. His story begins in North Adams, Massachusetts in 1959. He spent his childhood there and later in Tampa, Florida, where he was raised in an old school bus that his father had converted into a mobile home. Encouraged by his parents, Dr. Farmer developed a strong interest in the world around him at an early age. His intellect and incredible work ethic led him to excel in school and eventually to win a full scholarship to Duke University. It was there at Duke where his passion for service took root. After graduating, he traveled to Haiti, where he worked in public health clinics before pursuing his medical degree and doctorate in anthropology from Harvard University. In 1987, Dr. Farmer co-founded what would become his legacy, Partners in Health, whose mission is to bring modern medical science and high-quality care to those most in need and serve as an antidote to despair. Its banner has always been pragmatic solidarity in the fight for health and social justice. Dr. Farmer also used his gifts to shape young minds and the next generation of providers. He served as chief of the Division of Global Health Equity at Brigham and Women's Hospital in Boston and chair of the Department of Global Health and Social Medicine at Harvard Medical School. It was there at Harvard Medical School where our paths crossed in what proved to be one of the biggest blessings in my life. As my mentor and professor, Dr. Farmer embraced me, trained me, taught me, and encouraged me in all that I did. In short, I blossomed under his guidance. I was empowered under his wings. He taught me to channel that very same passion that I had as a student activist into fighting for social justice with my medical training. I remember one day in the class when he told us all of you are now part of the elite. The mere fact that you're sitting here at Harvard Medical School will make you an elite. And as someone who grew up in a trailer park and was the first generation of my family to graduate from high school, I immediately resisted that. No way, not me. How dare he say that? And now I won't say that what I was thinking in that moment, but ever the mind reader, Dr. Farmer looked me in the eyes and said, "Yes, you too, Raul." And his point was that now that we are at Harvard Medical School, we need to own that. We need to use our Harvard medical training and research skills for the poor and give them the best care always. And it was then that I understood the opportunity that I had to make a difference and serve those suffering from inequities with the care I would provide as a doctor. I spent many years under his wing, learning from him and training with him to provide humanitarian aid and care. And it was in the classroom at Harvard, in the rainforest of Chiapas, Mexico, and in the aftermath of the earthquake in Haiti that I learned from Paul the powerful act of accompaniment. I admired his humility with the people, his fierce advocacy with the powerful, his selfless and the enormous respect that he showed to all he cared for, regardless of income or education. He treated everyone as equals and worked to earn their respect. It is because of him that I stand before you all today, both as a physician and as a representative of the people. Dr. Farmer was a great man, a humble servant, and a fierce warrior for health and justice. I miss him. I know the world will too. So in his memory and in honor of all that he has done and achieved, I ask for all present to join me in a moment of silence. Thank you, and I yield back my time.